Welcome to MyKneeReplacementRecovery.com. I've talked about the medicines and some of the gels and lotions I used in my blog. Today I want to discuss and show you some of the ones that were most significant in my recovery. I began in the hospital with an IV drip that had painkiller in it, and after about 4 hours they weaned me from the IV onto Percocet. Percocet was the drug that was prescribed by my doctor. I was given only 50 tablets of it. I ended up taking 38 over the period that I used them. I took 4 a day to begin with, and then I was only taking those around the time that I would do my most difficult physical therapy, or when I was going to bed and couldn't sleep in the middle of the night. Often I would take one. I soon changed over to a Tylenol type product, and I started using those and weaned myself off of the Percocet. I'd still take maybe one of these a day, and I'd supplement them with the Tylenol product. I continued to take the Tylenol product up to about 8 or 10 weeks after my surgery. I would still take it now if I maybe overdid a therapy session and thought I might need some relief. I was also directed by my doctor to take 325 milligram aspirin every day for the first 48 days. I did that religiously first thing when I woke up in the morning. Because I was taking a trip soon after those 48 days and I was going to fly, I continued to take the aspirin until my return flight home, and no longer take aspirin. Another key medicine that I took immediately after the surgery in the hospital and then at home was stool softener. I was told the importance of having a bowel movement and that the stool softener would help. It definitely did. I had my first bowel movement 3 days after the surgery. First day I was on a liquid diet. I didn't really eat any normal food until the second day. I continued to take the stool softeners after I had that bowel movement and became regular right away. And after about 2 weeks, I quit taking those. When I first had the staples in at my knee, I needed some kind of lubrication, and I was told to get some antibiotic. This is a triple antibiotic that I would use, and I would smooth over the staples, and it would make my knee feel a little more flexible, and especially where it was scabbing up, it kept it moist and soft. Afterwards, I used a scar gel that helps with the scar healing, and my other product that I used probably 4 or 5 times a day the first 4 or 5 weeks was a aloe-based lotion, and I put that over the scar anytime that I thought it had dried out. Another important product was just regular lip balm. I was using that a lot. I was very thirsty, particularly at the beginning, and that came in very handy. These are the products that I use the most. You can look at the link at the bottom of my blog to read about my experience. Thank you for looking at my blog, MyKneeReplacementRecovery.com.